Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. As you know, every week on this program, I have a different physician, healthcare professional, someone to talk about different programs and services that we offer here at KRMC. I hope you'll stay tuned because I've got a really exciting guest on the program today. You're going to learn a lot. So stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is James Long. He's a nuclear medicine technologist. Did I get that right?
You got it. That is correct.
Here at KRMC in our imaging. Well, you're over at the imaging center, right?
Correct. And also our nuclear medicine department is at the hospital.
Oh, okay. So you go back and forth between the two. Very good. Well, thanks for being on the show today,
Absolutely.
James. I'm looking forward to getting to know more about you and about nuclear medicine and PET. We're going to talk more about that. But first, let's talk about James, because you're one of our, not newest, but you're fairly new here at KRMC.
Fairly fresh-faced.
Okay. So let's talk about it. You're from Minnesota originally?
Minnesota, correct. I did all my training up there. I did my training at the Mayo Clinic in Rochester, up in Minnesota. So, and that's how I ended up hearing about the job here, since all our radiologists were Mayo trained. So,
right.
I graduated in August, moved down here in September, avoided the winter in Minnesota,
and it was a brutal one. We were talking about that before the show. Man, this is
6 months of snow and cold.
I don't miss that.
Yeah, me neither. So
this is a good place to be. Like we talked about before the show, it's a perfect winter. You can play in the snow and it melts.
Yep.
My idea of perfect winter.
Yeah.
So, so you went to Mayo Clinic for your training, and then you came here in September. So, nuclear medicine. That sounds scary.
It does. We get a lot of people who hear the name and immediately get afraid from it, but it's a non-invasive diagnostic test. Most of our studies are comparable to X-rays or CT scans.
Okay.
So there's nothing to be afraid of. Nothing we give patients makes any difference to them. It's not going to make them feel funny or glow in the dark or anything crazy like
I know
that.
You always hear that. Am I going to glow in the dark?
Glow in the dark. No superpowers or anything fun. No Incredible Hulk. Hasn't happened yet, anyway. So.
Well, now, so what is the point of nuclear? What does that do different than other?
Nuclear medicine itself looks at it can look at every single organ system, and it looks more at the physiology of certain systems rather than the basic structure of it. So you get an X-ray and it shows the different structures. Nuclear medicine can go in. Our drugs generally go to different areas. They're tagged with a radioactive tracer that lets us take pictures of them.
So you kind of see it working?
Yep, you see how the different systems are working,
okay.
Whether everything's functioning properly, or if there's some sort of disorder.
Okay. So how does it know where to go? Sorry,
Good question. Generally, most of our compounds are based off of normal physiologic process. So, for PET, I'll use a PET example. It's sugar. It's sugar we use to put a radioactive tracer on. So, sugar is going to go to all the cells in the body, but it's going to go with the higher uptake to those cells that are actively growing, dividing, using energy. It's going to take that glucose in. So it's following a physiologic process.
So for our lay people that don't know what all that means, the physiological means what?
Function.
Okay.
So rather than like CT, X-ray, you're looking at form. Nuclear medicine and PET, you're looking at function.
Okay. So actually, like you said, actually seeing it working versus
Correct.
just a bone that's stagnant, just kind of sitting
Right.
there. You're actually looking at either blood moving through an organ pumping or...
Yeah. And you're looking to see if, anything's going on in there.
Okay. So we mentioned PET, so we should probably explain PET. Positive?
Right.
No.
Positron emission tomography.
Okay.
It gets that name based on the drugs that they use for PET are positron emitters. And there's a whole lot of nuclear physics we could get into covering that, but basically that's just the type of radioactive decay it goes under.
Okay.
And when it decays by that method, it sends out rays in 180 degrees that lets us take pictures of it, building a tomograph. So that's where you get Positron emission tomography.
Oh, okay, so it's the positrons that are emitting,
Yep.
and then...
You make
the
a
gr-
make a
tomog-
picture out of it to make a
Okay.
tomograph. So.
Okay, so do you have to do the nuclear medicine first for a PET to work?
Yeah. So how PET works? PET is just it's a specialized branch of nuclear medicine. It's just a different type of nuclear medicine.
Okay.
Generally, nuclear medicine, it's just a different type of camera. PET camera works, you have a 360-degree array of detectors.
So all the way around
Yep.
something
Yep.
in your body.
Correct. So it's kind of like a CT. Our camera looks just like a CT. It's got a little bit of a deeper tube, and then the PET portion is at the back of it.
Okay,
So you slide in and out just like a CT. The PET portion takes longer.
kind of like an MRI? I mean, it's
Yeah.
in between the two?
Yeah, it's kind of a blend of the two. Because when we do a PET scan, we do a low dose CT first to get positioning and, like I said, form, to blend the form with the function. So we do a low dose CT, and then our camera, how we do it, we take pictures. We get about a 10 centimeter view or so at a time. So we do, and the bed will move every couple of minutes. So we do.
Oh, okay. So you're laying on a bed.
Yep.
And do you go in like a MRI where you kind of get fed into
Correct.
a machine
correct.
sort
Yep.
of thing?
It's
Okay.
not as close and not as loud as an MRI.
Okay, so
where-
you don't have quite the issue with claustrophobia.
Right. Yep. It's about the size of a CT scanner, just
Okay,
a little
so
bit of a
it's-
deeper tube,
Okay.
not anything too crazy.
Okay, and then you're just slowly moving through it, and it's taking pictures as you go.
Correct. Correct.
Okay, so it's really nothing to be afraid of.
No, there's nothing really scary about it. It's most of our patients. What it's used for is generally PET is used to diagnose or stage cancers.
Okay.
So generally, the anxiety of that plays with having to go through our scan.
Sure.
But the scan itself is really fairly simple. What we do, we check blood sugar first, since we're going to be injecting that radioactive
Okay,
sugar.
so like a diabetic has to have maybe something a little different?
Yeah, we can still do them. We have to have their blood sugar fairly low. So the prep for our PET scan, we have to have them fasting. No high sugar diet before and the
Right,
day
okay.
before. So we get that blood sugar low, because if the blood sugar is too high, we're basically going to be taking a picture of soft tissue and blood pool.
Yeah.
It's not going to go where we need that sugar to go.
Because it's already there.
Correct. So,
Okay.
so we do that, check the blood sugar, make sure that's within range.
Okay.
We inject our tracer, and the tracer, as we were saying before, it doesn't really make you feel different
Yeah.
or anything like that. It's pretty easy. It's like a saline injection.
Okay.
And then we have them relax for 45 minutes.
Well, it gets into the body.
Yep, because that,
Works its way.
like I was saying before, that sugar is going to go to all the cells in the body.
Mm-hmm.
And if they're up and running around, it's going to go to the muscle. It's going to go to anything that's active.
And that's why it helps find a tumor, because
Right,
the tumor
because
is more active.
the cancer
and
cells are going to be actively dividing and growing, and they're going to be
They're
demanding
looking
sugar
for
from
food.
the body. Yep, exactly. Yep, yep. So we let them relax 45 minutes. We'll have them get up. We have them use the restroom. That tracer goes out through the bladder
Okay.
and through the kidneys. So we have them empty their bladder as best we can, take that picture, and then the scan itself is generally about 20-25 minutes.
Okay.
Certain diagnoses will differ a little bit, and
Maybe
we'll
a
do
little
some
longer.
extra images, but
Okay.
otherwise it's fairly simple, non-invasive, not too stressful of a
Yeah,
test.
that's
Get to
good.
relax for 45
Yeah.
minutes in a
See, when I take
recliner.
those kind of tests, I'm usually like, wake me up when I'm done. 'Cause you get me, horizontal, I'm going to
Yeah.
fall asleep.
Yep, exactly, and
Doesn't
that's-
happen very often in my life, so
Yeah.
I nap when I can.
Exactly, take advantage of it. You got an hour and a half of just nap time.
Yeah, there
with
you
us,
go.
so
You
that's
get
perfect.
headphones and you
Yeah.
let me go to my happy place and
Yeah.
just wake me up when I'm done. Now, we talked earlier about the radiologists that
Mm-hmm.
we have here, and we've had a number of them on the show, and different of the technologists that work at the imaging center. So how often are the radiologists actually there when you're doing these tests?
The radiologists aren't generally present while we're doing the scan.
Okay.
We always have a radiologist at the imaging center
Right.
in case something does come up. And they'll take a look at the images if we have any question about the images we should be doing, or if the patient has any questions, we can always contact the radiologist,
Okay.
and they're always good about helping us out and letting us know what kind of images they want to get from
Right,
us.
and then making sure, like, if you're not sure, is this exactly what you wanted, you can have them
Correct.
come look at it,
Yep.
and no, let's try that again kind of
Yep.
thing, or
Yep.
that's good.
Yeah.
Okay, that's cool.
So-
So, I mean, this is pretty techie stuff.
It is.
Obviously,
It's-
technologist. techie,
Yes,
yeah.
we're all nerds, unfortunately.
But how long did you have to go to school? That's
I
you to
have
learn
a,
lot.
yeah, I have a bachelor's degree in nuclear medicine technology. And how that works, the program I did generally, there's also associate's degrees, but the program I did, it was 3 years of college classes, and then a
So,
year.
like basic.
Yep.
getting a BA.
Sciences, everything
Okay.
you need to know to get into nuclear medicine.
Okay.
And then we do a 1-year internship, which I
Okay.
did at the Mayo Clinic for mine. But there's different routes to go
Mm-hmm.
about it. You can get a bachelor's in pretty much anything that has science, that the
Okay.
required science courses, and then you can go do your year internship. Or
Now, did you go to college in Rochester too?
I
Or-
went to college in St. Cloud,
Oh, okay.
Minnesota.
Yeah,
so.
so nearby. I mean,
Yeah.
not too far from.
Yeah.
Same general.
Yeah, same winters pretty much.
Yeah, that's true.
Yeah.
I spent a couple years in Waseca too, so
Oh, okay.
I know that whole area way
Yeah.
too well.
Yeah.
And can say I'm from there. That's a good thing.
Yeah,
So
exactly.
that's pretty cool though. That and then you got to do your internship at Mayo Clinic,
Correct, yeah.
which is pretty amazing.
Yeah, it
That's
is. And
awesome.
we spent a month down in Scottsdale too, so I got
Oh, okay.
I got a hang for the
For
Arizona summer.
What Arizona
so.
was going to be. Oh, were you there in the summer?
I was there in June. So.
Oh, well then, yeah, see, we're cool.
Yeah,
Compared to
comparatively much cooler. It was 120 degrees every day.
Oh, were
I
you
flew
there?
out of Minnesota and it was 45 degrees when I left, and I got off the plane and it was 125 degrees. So it was a little different.
That's a
but-
big difference. That's enough to make you go, oh my
Yeah.
gosh, what have I done?
Yeah, I was like, oh no, I'm gonna melt. But
Yeah.
handled it.
Very good.
Yeah.
Well, after that, Kingman's a breeze.
Yeah.
Okay,
Yeah.
good. Well, we're going to take a quick commercial break,
Okay.
and then we'll come back and talk some more about nuclear medicine.
All right.
And I hope you'll stay tuned because I know we're going to learn a lot more after this break. We'll be right back. Welcome back to Your Health Matters. My guest today is James Long. He's a nuclear medicine technologist. I got it right twice. Woohoo! I'm
very good.
doing good. I'm on a roll. Anyway, here at KMC, thanks again for being on the show,
You're very
James.
welcome. Thanks for having me.
So, nuclear medicine, it's kind of scary. I mean, just, people just, of course, they think nuclear, they think atom bombs, radiation, that kind of stuff.
Yeah.
So and I've heard this before, and I'm sorry, I didn't mean to interrupt you, but that from nuclear science, I mean, yes, came the atom bomb, but we also had many good things
Right.
that came.
When people hear nuclear, it's automatically a negative
Freak out, yeah.
connotation. But the radiation you get from this is not harmful at all. It's a very small, tiny dose of radiation. You get more from flying in a plane.
I was going to
pretty
say,
much.
people don't always realize that
Yeah.
we're around it all the time. We get from the
Right.
sun's
Cosmic
rays,
radiation, uranium, and
Right. And the
bedrock and everything. So
Yeah.
it's very small. It's just good at what it does. It gives off the right kind of radiation where we can take pictures of it.
Mm-hmm.
But there's no harm from it at all.
So if a person has been told they possibly have cancer, they need to have a nuclear PET CT done.
Mm-hmm.
If they have concerns, can they call the imaging center?
Yeah.
Do you talk to them?
Yep.
Okay.
We get that a lot.
Okay.
People concerned about what it all entails, if they're
Sure.
going to feel different, if they're going to get sick from it. We're happy to talk to them about it.
Okay. And like you mentioned, if they're diabetic or have issues with normal blood sugar
Yeah.
levels, then you're going to
Yep,
want
we
to
give
walk
them,
them through that.
when we
ahead of
schedule
time.
the pets, we give them, a diet plan to follow, guidelines to stick to.
Okay.
But we're always willing to help if they have any questions. They can
Okay.
call us, and we'll be happy to talk to them.
And that's important. I think people need to know and understand
Right.
what's going to be done, because then the whole procedure is going to be easier, both for them and for you.
Right. If your mind's at ease, it's a lot smoother than
Right.
being worried about it and high-strung about it, because It is a scary thing. I mean,
Yeah.
if you're recently diagnosed with cancer.
Yeah, and that's
this is-
scary in and of itself.
Exactly, and this is one of the first things they do to get a baseline and get
Okay.
a staging of it. So,
So do people then, if I'm fighting cancer,
Mm-hmm.
they've already been diagnosed, I have one of that PET done at the beginning. Do
Yep.
you do it later then
yep,
to measure?
we'll do it. We generally do it beginning, right before treatment, after treatment,
Okay.
and we keep monitoring it.
Okay.
Generally, it's 6 months to start out with. Once it's gone, we'll go to a year. After that, it's another 5 years. So
Okay.
that's generally how it works out. And that's depending on the doctor, the oncologist
Sure.
that's taking
We've-
care of the case. But generally, that's how it works out. We
Medical
like-
history kind of thing.
Yeah. So we follow them along in
Okay.
their progress, which is always, it's nice to be able
See
to
the-
see progress.
Right,
which is always,
yeah, and to see
it's
someone
always
come
good,
back
so.
at 5 years, that's like a big,
Yep,
good
that's a wonderful
job,
thing to
yeah.
happen. So.
So you've only been in Kingman since September,
Yeah,
right? So
yeah.
you haven't had a chance to build up a lot of those long-term patients
Yep, I
yet.
haven't had
but
too
that's
many
okay.
repeats yet, but hopefully we'll keep that coming.
Right.
so.
Well, and that I think you'll find that's one of the cool things I think about living in Kingman is that we're a small enough community that you're going to run into people
Right.
and get to know people really well, and you'll see them whether at the movies or at Safeway or Walmart. And, oh, hi, how you doing?
Yeah,
Feel better?
exactly. yeah, that is nice. So the small town feel of it is great.
Yeah,
That's
absolutely.
always rewarding.
Yep, and I tell staff all the time too, it's another reason that we have to make sure we always provide the best possible care because you're going to run into those folks.
yeah, exactly.
It's not like even in Minneapolis where you might see someone and then never see them again.
Right.
Or see them and not know them because it's been so long. So
Right.
you definitely have a closer relationship with your neighbors here than you do
That
in
is
the big
very
city.
true. Yeah.
So the nuclear side of it, when we were talking about the fears, and then I know we mentioned this before the break, but you did say something about how it just flushes through your system.
Yeah.
It's-
Generally stays in the tracer we use for PET scans. It's short-lived. It stays in your body. You know, by the time we take the pictures, it's almost half gone from what we
Oh.
started with. And it
Except in
continues
those
that way.
areas? Is that
Yeah.
because it's like a magnet, it pulls them to those
Yeah,
things?
that just when that glucose or when the cells take up that sugar,
Mm-hmm.
it stays there. It becomes trapped and lets us take pictures of it. But it flushes pretty quickly through kidneys and out the bladder.
Okay.
And the isotope itself decays really quickly, so it's not
Okay.
in your body very long
Yeah.
at all. You know, a day and it'll be completely
Really
gone.
gone. You wouldn't even,
Yeah.
if you went back, you wouldn't be able to see
Nope,
anything.
nothing on there.
Now, we talked about tomography.
Yep.
And what exactly does that mean? Is it a chart? Is it a?
So what it
3D?
does, it makes a 3D image of where that tracer has gone, and we do it we use a CT along with it. So we get a 3D CT fused with our PET scan, so we can see exactly where in the body that is, and then the doctors look at it. And it's all computerized. Everything's done on the computer. They read it right off of the
So it's
computer.
not like in the old days where you had an X-ray film
Yeah.
kind of thing.
Because when we do our pictures, we generally get, close to 900 images that
Oh,
we
wow.
take. So that would be a lot of film.
Yeah, it would.
And the radiologist wouldn't really like to flip through that.
No,
so
probably not.
They read it all on the computer. They can go through it slice by slice, looking at,
So it's showing it.
Yeah, so we get a
through the-
3D image, 3D model, but then you can do slices through it, so you can look at it in different views, different
That's
planes.
so cool.
Yeah.
How they're able to do that.
Yeah, it's amazing. The technology of it is very cool.
Well, and it's cool. We talk about this on the program all the time. How amazing it is that Kingman has that kind of technology.
Right.
I mean, yeah, you had it at Mayo Clinic, but most people don't expect
Right,
that kind of stuff
exactly.
in Kingman.
Yeah. and-
So we've talked about PET, and I know we've had PET CT, the MRI, regular X-rays.
Mm-hmm.
Is nuclear medicine, is that the wave of the future? Is it going to replace all those other kind of?
No,
X-rays?
you're always going to need the CT, the MRI, the X-rays.
They see things differently, right?
Right, exactly. Nuclear medicine just gives us a different view to look
Okay.
at. And with PET, the oncologists really like PET to do the staging because you
Okay.
see if it's confined to one area, if it's spread throughout the body. And the general nuclear medicine studies are it's just another way to look at things to see how everything's working in
Okay.
the body.
So it's not like someday that's the only way we'll ever
No,
look at it.
no,
Because it's more specific, like you mentioned earlier, to function.
Right, exactly.
Okay.
Nuclear medicine is sometimes called unclear medicine because our pictures aren't. If you don't know what you're looking at, it's
so I wouldn't be
like
able to
watching
look
a
at it.
snowstorm.
Okay.
So, it's
So it's
you
not
need
like an
everything else to
X-ray
kind
where
of
you
get
can
it together.
see a crack in the bone,
Right.
kind of thing. It's not that clear cut.
No, but it's really good at showing the function of
Right.
it. So you're
So
always going to
someone
need
who's
those
trained,
other things.
that's got to be. Do you have to have special glasses, like going to a 3D movie?
X-ray glasses.
Yeah.
No, not.
I
You
just
start
am-
to see things though in a nuclear medicine sort of perspective. But,
I mean, when you go leave work, you're still
yeah,
seeing snowy
yep,
things
still
in your.
seeing dots everywhere.
So obviously that takes some special training then to
Hmm.
know what you're looking at and what you're looking for.
Yeah, it's and the radiologists here have gone through at the Mayo Clinic. They have really great training up there for nuclear medicine, PET studies. Pretty much all radiology studies they're great at up there. So,
Yeah.
and I was lucky enough to do my training there. So, you get to see it a lot. You get a lot of studies to look at and to get a hang of it.
So did you get other, like the MRI training or anything like that too?
No,
You just focused
I
on
was.
nuclear.
Yep, I was. There are some technologists who go from X-ray to nuclear medicine, but I was strictly nuclear medicine.
So now, I got to ask.
Mhm.
I was thinking about this. I was like, so when you were a little boy, did you say, when I grow up, I'm going to be a nuclear technologist?
No, it's kind of a funny story how I came upon it. It worked out really well. I was really sick in high school.
Okay.
I had been losing all this weight and wasn't able to eat very well, and I had a nuclear medicine study done that showed it was a gastric empty study, which we do here as well.
Does that mean your tummy's empty?
Right.
Is that what a gastric empty?
Basically, what a gastric empty study is, we eat. The study I did, I ate radioactive eggs. Here we do it with radioactive oatmeal.
Are you serious?
Yep, and you watch it as it goes through the stomach and into the small intestine, and
So it follows it. kind of
yep.
as
So you
it's
see,
going.
and you have normal values, and you do all your calculations off there to see what it's emptying. But
Okay.
showed out when I was in high school that my stomach wasn't working correctly, so I had to go on a special diet and everything. But that's how I got into it. I got into college and was thinking some field of medicine to go
Right.
into, and the college I was going to offered nuclear medicine, and so I got into the program and loved it, and
Cool.
it worked out real well for me. So.
Well, that's pretty cool, though.
Yeah.
That it came from a personal level.
Yeah.
So you know both sides, from a
Yep,
patient
exactly.
side as well as the technicians or the technologist side of
Yeah.
it. So you know both, and that, I think that's a value that you bring
Yeah.
to the patient.
Right, it's definitely helpful, and because I know how scary it can
Right,
be, and
yeah.
you know, kind of the fear of the unknown of what's
Right.
actually going on.
Yeah.
So it's nice to be able to explain.
And you're here to tell about
I've
it.
been there and done that. So.
Yeah, you lived through it.
Yeah, exactly. I didn't grow anything extra
No.
weird coming out. So
There is a funny lump behind you. Is that an egg coming out? No. So radioactive eggs and radioactive oatmeal, that's interesting.
Yeah.
And is that specially grown oatmeal, or they just inject it?
we just inject a tracer into it.
Okay.
I don't know that there's radioactive oats growing anywhere, but
Yeah,
maybe
around
knows?
Area 51. I bet.
yeah, that's true.
Well, if you ever need eggs, let me know. Okay, if you want to go to
Okay.
I've got tons of chickens at
All
home, so
right,
I'd be happy to
perfect.
bring you eggs.
There we go.
That's pretty cool.
Keep that in
And-
mind.
yeah, I'm just joking about that, but most people like my eggs just as they are. I'm not sure they want. But I really appreciate you taking time, James, to be on
Absolutely.
the show, and I hope we've answered some people's questions and maybe allayed some of their concerns.
Yeah, I
and,
hope so.
and know that they can call the imaging center and ask for James Long, and you can answer more
Yep,
questions
be
if they
happy
have
to.
them. Okay, well, thanks again for
Thank
being
you.
welcome to KRMC and to Kingman.
Thank you very much.
I hope you learned a lot watching the show today, and stay tuned for next week because I'll have another great guest on the program then. Talk to you later.